Now, nurses across the country, apart from Scotland, are going to strike for 2 days in December. It's going to be their biggest walkout in the NHS's history.
And, of course, this comes after government ministers apparently declined the RCN's formal offer of negotiations regarding pay and unsafe staffing levels.
Well, let's talk to Alice Porter, who's outside the Royal College of Nursing in central London. Morning to you, Alice. I mean, look, what are they saying about this strike action? Because you can't imagine they actually want to take it.
Yeah, good morning to you. Well, yes, the Royal College of Nursing say this industrial action is taking place because the government, they claim, refused to sit down and negotiate with them. And that's why we're having strikes taking place in England, Wales and Northern Ireland, not in Scotland, because negotiations are still ongoing. But it's incredibly significant because we have never had nurses go on strike before. So, of course, it's going to have an enormous impact on patients across the country. Now, we knew 2 weeks ago that the nurses were going to be going on strike. We've now got the dates, and they are the 15th and 20th of December. And I suppose the real concern there is, of course, that is very much in the run-up to Christmas, when already there are severe winter pressures on the NHS. We know that emergency care will be staffed, but we don't know yet until next week which areas of the NHS will be particularly hit. And this is all because of an ongoing dispute with the government over pay, as so many of these strikes are. The government gave nurses a 4.75% pay rise in the summer, a bit more for those who were on slightly lower incomes. But the RCN say that in real terms, for more experienced nurses, they're still suffering a 20% pay cut because of inflation. It's not just the RCN saying that, it's a number of economists as well. So that's very much their argument. And they're saying because of the situation with poor pay, so many members of staff are leaving. And they claim in the last year, 25,000 members of the Council for Midwives and Nurse left the council register, and so they're saying they're very much making the economic argument that the government needs to make continuing to plug the gaps in their workforce and with agency staff, and therefore shouldn't nurses simply be paid more money? That's very much their argument.
And, of course, it's not just nurses, it's other healthcare workers as well who are thinking of striking.
That's right. Today, the ballot closes for Unison members. We've got Unite members for the NHS Unite members, which is the UK's largest health union. They're balloting next week. We've got physiotherapists, midwives, potentially junior doctors next year. The government say that they simply cannot pay nurses what they're asking for, which they say would come to £10 billion a year. But I think the real difficulty for the government is, of course, this is very emotive. Anything we have the NHS is always very emotive, and it will put an enormous pressure on the government, particularly over the winter period.
For now, thanks very much indeed. Your thoughts on that would be very welcome this morning. GBViews at gbnews.uk.
And we've got a lot of views from people coming in saying they support the strikes, that it's not like it was in the 70s.